Tens of thousands took to the streets honoring George Floyd and protesting racism.
This has been a year of reckoning with systemic racism, with police violence, and with the profound inequities in American society.
The U.S. coronavirus death toll,
a staggering number, reached at a shocking pace.
And long-standing disparities in health outcomes have been exposed by a pandemic that has hit low-income communities of color with disproportionate force. All of this has sparked a national conversation about social justice. And it reminds us that one of the Bloomberg American Health Initiative's themes, equity, is deeply linked to all 5 of the initiative's focus areas. As we all struggle to meet this moment, the summit provides a venue to examine how considerations of racial equity must be woven into all aspects of public health.
Here are 2 examples.
The video recorded death of George Floyd and others at the hands of police have increased tensions between communities of color and police departments across the nation.
Police violence creates a climate of distrust that makes it difficult for communities to address violent crime.
And the racial differences in the composition of police departments and the communities of color they serve appear to be directly and indirectly associated with racial disparities in arrest rates.
African Americans are also more likely to be searched, frisked, and have force used against them. They are more likely to be fatally shot by police of a different race, and 3 times more likely than white people to be killed.
With this research project, we seek to create a comprehensive measure of residents' experiences with the police to understand
how the racial makeup of neighborhoods and the racial composition of police departments affect rate of arrests and violence.
We believe the results of this project could provide evidence to help policymakers adjust the racial composition of police departments to better align with the racial fabric of the communities they serve.
Active transportation infrastructure, including walking paths, trails, and bike lanes, is an increasingly used, durable, preventive health tool for addressing environmental challenges and chronic disease. Because of its role as infrastructure, it offers a route to fewer disparities in health outcomes across our cities. The benefits of the infrastructure, however, are not equitably distributed across neighborhoods. Arguments to support active transportation infrastructure usually highlight potential benefits for low-income and minority communities, which is important, yet it is these very communities that see fewer reported benefits compared to wealthier or white neighborhoods. The Baltimore Greenway Trails Coalition proposed a plan for a 35-mile loop of trails around Baltimore City to serve as a means of transportation and recreation. The goal of our study is to better understand the perspectives of community members and stakeholders in 2 of Baltimore's historic Black communities, each with a history of disinvestment and historical racism, as they weigh the benefits and risks of trail development.
From trails to police departments, from overdoses to food insecurity to adolescent health, the Bloomberg American Health Initiative recognizes the role of race and racism and will work with our partners to achieve equity.